Any type of filler injection can get lumpy based on the texture of the filler and also based on the plane of injection. This particular part about the lips are presence of small salivary glands in both upper and lower lips. And if the filler gets injected into those small salivary glands, they can get inflamed or swollen up, and that can present as a lump. Most of the fillers that are used these days are hyaluronic acid based fillers, and they're 100% dissolvable or reversible. For the most part, because of the constant movement of the muscle, the filler gets dissolved faster or absorbed faster. Most lip fillers will be gone within 6 to 9 months. Any type of a filler can present as a little bit more fullness in the morning, and that's just purely because of the gravity dependent aspect of laying down and having more flow into the head. So during the day, because person is standing and sitting most of the times, that flow will pull it down and there will be less fullness in that area. Well, first of all, if the lips don't look normal, they're particularly unusual, probably it was, and you can see a lot of them on Instagram. The ratios a lot of times are not preserved, or the particular topography or shape, particular areas of the lip as far as the prominences or concavities have not been preserved. One of the ratios that are important in most ethnicities, including Caucasians, the upper lip is smaller than the lower lip. The ratio is roughly about 2/3 to 1. So if you see a Caucasian person with upper lip the same size or a little bit bigger than the lower lip, it's been done. Also, as far as these borders, we call them vermilion borders. When the injection gets done, it needs to be a subtle definition on it. If it's particularly prominent and sticking out, then it's done. The pillows and the cupid bow of the lip, they needs to be proportionally augmented. If you see a particular disproportion in that area, they are done. And the last one, the corner of the upper lip, it's usually flat. If it's particularly prominent or sticking out, it's been done. Of course, if you couldn't, you wouldn't be doing the lip augmentations. In our practice, we recommend for 24 hours not to wear any makeup, because from those pores where the injection was done, we want to make sure there is minimal exposure to bacteria. So we recommend no makeup. We cover the mucosa with a small silver type of antibiotic cream that's going to protect and create a layer over the lip. And I tell my patients the next morning they can wash it and they can wear makeup and they can pretend like it's their own lip, fully back to normal as far as any type of activity. Well, the bar is so high during pregnancy that for any type of a medication or injection to be considered safe, we need quite a bit of strong and robust studies. Most likely it is safe during the injection, during the pregnancy, because hyaluronic acid is a substance of our cell, and lidocaine has been around for a long time and has been used in pregnant women for different type of surgical procedures. However, because this is an elective procedure, it's recommended not to do it during pregnancy in case if there could be any adverse association. The same goes for breastfeeding, kind of like pregnancy. It's hard to show any particular association as far as negative effects, but since it's elective and the bar is high, in general we recommend minimizing these type of injections during breastfeeding. But the risk of any effect on the infant is even lower than pregnancy, because the amount of lidocaine in the filler, which is absorbed for the most part locally, it's very unlikely to be able to get absorbed into the breast milk and create a negative or adverse effect for the infant. But it's just a safer practice. That's a good question. The answer to that is there is a small association between cold sores and lip fillers. There's been a couple of studies investigating it, and there seems to be less than 1% association with it. So for people who are high risk with high frequency of cold sores, a preventive course of antiviral like acyclovir is recommended prior to injections.